Hey Doc, it's Nick. Here's a treatment plan that you had sent for review. Overall, I think this is a really good case for Invisalign. Reason being, patient is class 1 molar, class 1 canine, and has relatively small amounts of crowding in the anterior. So these are perfect cases for Invisalign. There's really no need to extrude any of these teeth or intrude, which are more difficult movements to do with clear aligner therapy. So yeah, this is a perfect case, but let's walk through a few of the areas of concern. I always look at the sagittal classification. Excuse me. I don't think there's any reason here whatsoever to use elastics or any sort of sagittal corrections. She does appear a little bit trapped in the premolars. Trapped or entrapment can occur in the anterior, like you and I have talked about in the past, but it can occur posteriorly. And it typically happens when you see these severely tilted upper premolars. Not really a big concern if you have canine rise. Canine rise gives us the ability to exclude posterior teeth, but these palatally tipped premolars are at higher risk for developing instability, excessive wear and attrition over time as the canines potentially wear. So if you're going to do Invisalign here, I would consider uprighting these premolars more than what the Invisalign had programmed here. We'll walk through that in a second, but just kind of giving you my 10,000 foot view assessment of the case. I always like to look at the Bolton analysis here, 0.2, very minimal. Again, Bolton analysis is a measurement of tooth width discrepancies between the upper and lower arch. So it helps us to understand if there is a need for some sort of sagittal correction, IPR, excessive proclination or retraction of the teeth, expansion, all of these advanced concepts so that we can get the arches aligned. When you see 0.2 here, that's rather minimal. So I don't think there's any IPR programmed here. Yeah, there's not. So yeah, relatively straightforward case. I think the only thing I would do is maybe look at having them upright these lower posterior teeth. Reason being, they're rather lingually tipped, which can inhibit tongue space. As we know, that can create breathing problems and sleep apnea problems later in life. But more importantly, we're looking at that entrapment thing again. So if we upright these premolars and upright these teeth here, we're more likely to have clearance during lateral intrusive movements throughout her life. So that's pretty much it. I think the rest of the case is self-explanatory. The buttons here, you definitely want to have some buttons. Buttons help trace seat and retain on the teeth. This is not necessarily a case you need a whole lot of time with each tray. I think this is a case you could do 7 days rather predictably. You could probably even push the envelope with 5 days if you're only doing the anterior teeth, but if you are proclining the posterior teeth, I would keep it at 7. If you do procline the posterior teeth, you're probably going to see about 20 trays. The last thing I would do, I don't see why they have trays stop at different points in time. At the end of the day, if the patient's going to wear the trays, I would rather spread out the movement over all of the trays that the opposing tray needs to do to get the movement in question. So I always tell them, please have all trays end at the same point in time. It's built into our clinical preferences. Clinical preferences with Invisalign are rules that the technician is supposed to do for our cases. For whatever reason, they overlook it quite often. So do as you may, but I would have them equal the number of trays by spreading out the movement on the upper arch to match the timing of the lower arch. And that's about it. All right, man. Let me know if you have any further questions.